My name is Madeleine Durand. I'm a CTN, the Postdoctoral Fellow. I'm also a general internist and an epidemiologist. I work in Montreal at the CHUM. My research interests are mainly in chronic disease linked to HIV. And my present research project is the Canadian HIV and aging cohort, focusing on determinants of cardiovascular health in people living with HIV. This cohort has just been started. It has been initiated by Dr. Cécile Tremblay. We have been working on the pilot for over a year and a half now, and recently we got funded by CIHR. So the cohort is a prospective cohort study where we will enroll 1,000 HIV-positive individuals and 1,000 HIV-negative controls. And a subset of this cohort will undergo very novel cardiac imaging modalities. They will undergo metabolic testing for glucose tolerance. They will undergo immunological testing to see if there is a link between immune inflammation and development of cardiovascular disease. And they will also undergo genetic testing to see if the genetic risk profiles are similar in people living with HIV than in people not living with HIV. The cohort is an important initiative because cardiovascular health has a significant impact and can have a significantly negative impact on the life of people living with HIV. And we want to characterize the disease further. Is this disease the same in people living with HIV as in people not living with HIV? Should it be approached in the same way? Should it be prevented in the same way? And should it be treated in the same way? So we're hoping to get answers to these important clinical questions via the HIV and aging cohort. Nowadays, HIV has become a chronic condition and people living with HIV should have normal lives. Now we know that cardiovascular disease is more and more prevalent in these patients. We know that they do have more cardiovascular disease than HIV-negative patients. And so as a doctor and a general internist, all of these chronic metabolic conditions are of interest to me. And I believe it's very important to know more about what are the determinants in HIV of cardiovascular disease. So how can we approach these chronic diseases for this patient population? How can we prevent them better to help them having normal lives and to lead the best lives they can, even though they are living with this chronic infection?